जस्ट ए मिनट सर कुछ एक मिनट नेक्स्ट नेक्स्ट नहीं हो रहा हाँ प्लीज So among the first vaccine I will talk pneumococcal vaccines. There are two types of pneumococcal vaccine. One of them is called pneumococcal conjugate vaccine or PCV. Another type is called pneumococcal polysaccharide vaccine or PPSV23. So PCV, whenever the term conjugate is there, that means the antigens have been combined with certain proteins and that increase the immunogenicity as well as longevity of the antigens. So whatever vaccine is a conjugate vaccine, that means it is a very long-acting vaccine. So this vaccine gives cellular and herd immunity, and this is used once only in lifetime for adults. Whereas in children, in Indian Academy of Pediatrics schedule, 3+1 doses are given. 3 at 6 weeks, 10 weeks, and 14 weeks, and subsequent booster at 15 weeks, 15 months of life. Whereas the government of schedule is 2+1. And in the national program, it was introduced in 2021 when Serum Institute of India manufactured its Pneumococcal vaccine. Before that, since 2017, Prevnar 13 was being used in 5 states of India. So there are different types of pneumococcal conjugate vaccine. PCV10 by the name of Pneumocil. Another name is Synflorix 10. Then Nubivac by Biological Evans. PCV14, this is 14. So these vaccines are used only for children. Then there are PCV15, PCV20, and PCV21. 21 was introduced in USA only in last June 24. All these vaccines 15, 20, 21, they are not available in India. Prevnar 13 is the commonest vaccine available in India. This is used both for children as well as adults. As per Dr. Ajay Roda, scientifically for children, this is the number 1 vaccine and number 2 is the Nubivac, although it contains 14 strains. Normal people above the age of 50 years means they don't have any disease, any comorbidity. Single dose of PCV 13 is recommended. But if the person below 50 with some immune suppression, diseases like chronic kidney disease, nephrotic syndrome, long-term steroid use, HIV positive, acyclovir, functional or anatomical, then PCV 13 is given. It is followed by a dose of PPSV 23 after 8 weeks and 5 years. So this is a picture of Prevnar 13 available for adults in India. Coming to second type of vaccine, pneumococcal polysaccharide vaccine or PPSV 23. This is available by the name of Pneumovax in India. I have written two figures, 2300 and 1840. 2300 is MRP, 1840 you will get it from the distributor or the wholesaler. This is a 23-valent vaccine. It gives weak immunity which lasts only 5 to 10 years. This is T-cell independent, means does not give any cellular immunity. Persons 19 to 50 years with comorbidities like asthma, heart disease, diabetes, chronic smokers, or if you are living in cities like Gurgaon or Delhi, there also single dose of this vaccine PPSV 23 is recommended. Whereas in persons with immune suppression, whatever may be the age, first PCV 13 and followed by 2 doses of PPSV 23 after 8 weeks and 5 years. Even in children, if they have comorbidities, they have got this PCV 13 vaccination, then you can go for PPSV 23 after the age of 2 years. This is not effective before the age of 2 years. And if the child is having immune suppressive disease, then 2 vaccines are needed in children also. Pneumococcus is the most common cause of infection among persons who are admitted in ICUs. And these days, most of these bacteria, they are resistant to the antibiotics. So they are leading cause of mortality among persons who are admitted in ICU. And in subsequent years, in 10 to 20 years, this figure will going to increase. Coming to flu and typhoid vaccine. Both these vaccines, they are not in the national immunization schedule, but they are recommended by the Indian Academy of Pediatrics. Flu vaccine, this is an inactivated. Till 2024, it was tetravalent, but as per information provided by Dr. Arora, from this year it will be a trivalent vaccine. This is split variant vaccine. Various state names are given. The rates vary from about 2000 to 2400, but you can get all these vaccine between 800 to 900 rupees from the dealer. This vaccine prevents from swine flu also. All doctors, all healthcare workers, and pregnant women, plus anybody with comorbidity, whether children above the age of 5 years or adults, they should get these vaccines. There are two seasons for flu. One in the rainy season and second in the month of January. So two different vaccines they arrive. One of them is called Northern Hemisphere and second is called the Southern Hemisphere. Northern Hemisphere vaccine comes in the winter and Southern Hemisphere comes in the February, March or April, depending upon the city. In Bhiwani, it reaches quite late, but in Gurgaon, it becomes available in February, March, or maybe in April. There is also live vaccine, which is called Nasovac, S4 nasal vaccine. This is manufactured by Serum Institute of India, MRP 1600 rupees. Then coming to second vaccine, typhoid conjugate vaccine. This is also not available in the national immunization schedule, but Indian Academy of Pediatrics recommends it at the age of 6 months, anytime between 6 months to 9 years. The various trade names are there. You will get it for about 800 or 850 rupees, whatever may be the price written. Only single dose is given. This vaccine is once in a lifetime. In the literature, product insert, it is mentioned that 6 months to 40 years, 45 years. But this vaccine can be used for any age. The most of the trials, they were done between the age of 6 months to 45 years. That is why the information provided by this Bharat Biotech says 6 months to 45 years. But many trials were done till the age of 93 also. So I got this vaccine in 2020 when I was over 60. And this is the most cost-effective vaccine because only one vaccine is to be used. And considering that you have to, some person they go on getting typhoid repeatedly, but if they get this vaccine, then they can get rid of repeated infections because the immunity given by the vaccine is more as compared to the natural infections. And one thing is more, both these vaccine same dose for children as well as for adults, 0.5 ml. Earlier, the dose for children for flu vaccine was 0.25 ml, but for the last 3 years, same dose has been recommended for even children 6 months of age. In children, it is recommended at the age of flu vaccine 6 months and 7 years, and subsequently yearly till the age of 5 years. This is Indian made vaccine by the Zydus Cadila. MRP is about 1600 rupees. But you will get it only for this is typhoid vaccine by Bharat Biotech. Other companies they also manufacture this vaccine, Typhoid, Zyvac, TCV. Coming to measles, mumps, and rubella. MMR vaccine. This is a live attenuated vaccine. The price 660. Priorix, Zyvac, the different names. Single dose of this vaccine must be given in preconception period or to the young girls or college going girls. If the girls who are going to be married, they are having a roca or they are just getting engaged, one should consider this vaccine at that time because this prevents a condition called congenital rubella syndrome. But pregnancy should be avoided for 1 month. But if accidentally this vaccine is given in pregnancy, this is not an indication for to terminate pregnancy. So to prevent congenital rubella syndrome, only one dose is given. But for all other health workers or other normal people, 2 doses are recommended. In the national program, measles and rubella vaccine, MR is used 2 doses, 9 months and 18 months, whereas Indian Academy of Pediatrics recommends 3 doses at 9 months, first booster at 15 months, and second booster at 4 to 6 years of age. I will talk in detail about this later. Congenital rubella syndrome triad. So this is Tresivac. Coming to hepatitis vaccine, hepatitis A vaccines. So this is also not available in the national immunization schedule, but recommended by the Indian Academy of Pediatrics at the age of 12 months. There are two types of vaccine, killed vaccine and live vaccine. Killed vaccine comes by the name of Havrix 1440 for adults. This contains 1 ml. However, this is not available, at least in Bhiwani, this is not available and may not be available in Gurgaon also. So you may have to combine 2 vials of Havrix 720, mean pediatric vaccine, which contains 0.5 ml. So combining two vaccines of Havrix 720 will make it 1 dose for adults. And second dose is used after 6 months, as in children, 12 months and 18 months, in adults also at 6 months interval. Live vaccine come by the name of BioVac A. Here the dose is same for children as well as for adults. This is given, all live vaccine they are given subcutaneously. And dose is same for children and adults. All adults, all healthcare workers, if they have not been given vaccination in childhood, or if they did not had hepatitis A so far, then they must get these vaccines. And all persons who are having some problem in the liver, chronic hepatitis or elevated liver enzymes, they also do go for this vaccine because even hepatitis A attack may cause fulminant hepatitis in them. So this is Havrix 720. Coming to hepatitis B. Hepatitis B is used in the national immunization program at birth and subsequently at 4, 6, 10, and 14 weeks. And most of the children they get this vaccine, but if you have by chance some of the children they miss out. So if the one doesn't had not been given this vaccine, then he can go for the 3 vaccines at 0, 1, and 6 months. Boosters are usually not recommended, but after the age of 50 years, your immunity gets low. You can go for a booster without testing your antibodies, or you can get your IgG levels checked. If they are below 10, go for a booster. If they are 0, go for 3 doses of these vaccines. So without getting IgG level checked, because we have got this vaccination about 25 to 30 years ago, if you are above 50, you can go for a booster. And cost is about 80 rupees. MRP is 80 rupees. Chickenpox, varicella, and zoster. There are two different diseases, herpes zoster and chickenpox. There are different diseases, but the virus is the same, caused by varicella zoster virus. Varicella vaccine this is a live attenuated vaccine. 2 doses are given at 1 to 2 months interval in adults or above the age of 13 years. However, in children, the gap is 3 months. The first dose is recommended at the age of 15 months and second dose at the age of 18 months or more. Some of the pediatricians they still continue to use second dose at the age of 4 to 6 years, which exposes about 19% of the children to chickenpox because first dose gives immunity up to 80%, whereas 2 doses give immunity up to 90%. So take care of primary vaccine failure. Second dose should be given in small children at after 3 months rather than waiting till the age of 4 to 6 years. All adults, all healthcare workers, they should be given this vaccine if they are not sure of their vaccination or if they did not had chickenpox in earlier life. And this vaccine should be offered to all the contacts of herpes zoster patients also. I offer to patients who come to me with herpes zoster ophthalmicus, ask their family members that please go for vaccination if you did not had vaccination or if you did not had chickenpox. Shingles or zoster vaccine. This is different vaccine. Purpose is same. The Shingrix vaccine that became available in 2023, it costs about 11,000 rupees per dose. This will prevent herpes zoster infection in persons above the age of 50 years. However, every immunocompromised person, even if he is below 50, he should go for 2 doses of this vaccine. This is a non-live vaccine, which unlike Zostavax, which came earlier in 2017, and it was withdrawn very soon because there were no takers for that vaccine, Zostavax. And 2 doses had to be used at the gap of 2 to 6 months. And this is a heavy dose vaccine, and there should be some holiday, or you should take this vaccine on Friday so that you can have rest on Saturday and Sunday, or if there is a holiday after your vaccination. Tdap. This contains reduced dosage of diphtheria and pertussis vaccine. As you know, DPT vaccine cannot be used after the age of 7 years. So this vaccine has been developed which contain different type of pertussis vaccine, that is called acellular pertussis vaccine as compared to the whole cell vaccine. So this vaccine is used every 10 years after the age of 10 up to the age of 65 years, comes by the name of Boostrix and Adacel. If one is not sure of earlier DPT vaccination, then second and third dose can be given of TD. T is capital, D is small. The different vaccine can be used in adults after a gap of 1 month and 6 months. In pregnancy, one dose of Tdap is must, even if the pregnancy happens next year. And this vaccine is must for all healthcare workers, especially all the staff of the children hospital and maternity homes, because the children should not be exposed to pertussis. 50% of the deaths due to pertussis, they occur in the first 2 months of life. If the mother did not had this vaccination, Tdap vaccination, then the child can get infection before he gets the effect of vaccination at the age of 1.5 months. So painful and painless vaccine. This concerns pertussis component of the vaccine. TDWP. This is the vaccine available in the government setup. Pentavac contains these wholesale pertussis vaccine. This is cheaper and this is available in the government schedule. Whereas in private practice, we use Infendix Hexa or Hexaxim, which contain acellular type of pertussis component. The most of the children they weep they weep after this vaccine TDWP, wholesale pertussis vaccine, most painful vaccine. Whereas AP vaccine or acellular type of pertussis vaccine, where the only some parts of the bacteria or some antigens are used, this causes less side effects. Therefore, it is called painless vaccine. It does not refer to the pain caused by the needle. Tdap, as I talked earlier, this is for adults above the age of 7 years, used in pregnancy as well as in adults every 10 years. कोरोना से सबको डर लगता था. कोरोना में 100 में से 1 की मौत होती थी, और उनमें से भी उसके अलावा भी बहुत से लोग होते थे जिनको डायग्नोसिस भी नहीं होता था, ऐसे एसिम्टोमेटिक होते थे. तो मान लीजिए 200 में से 400 में से 500 में से 1 मौत होती थी. लेकिन यहाँ पे रेबीज वैक्सीन है. रेबीज की बीमारी है, 100% फेटल है. तो ऑल ऑफ अस मस्ट गेट दिस वैक्सीन प्री एक्सपोजर rather than waiting for a dog bite or contact with some other animals or rats or bats. So pre-exposure 3 doses are used at 0, 7 and 21 days. And if subsequently you happen to be bitten by a dog, then you need not panic. You just go for 2 more doses at 0 and 3 days. And no antibodies are needed here if you are vaccinated earlier. And this is one of the cheaper vaccines. Post-exposure 5 doses are used 0, 3, 7, 14 and 28 days. Plus you have to go for antibodies. And antibodies, they are not available in every city, every chemist. If you are going to a hill station, even to a, say Goa, the antibodies may not be available there. So class 3 bites is if you are touched the mucosa, that becomes class 3 bites, or there is oozing of blood, that is class 3 bites. All healthcare workers, animal handlers must get this vaccine. Even everybody should must get this vaccine pre-exposure, because about 35,000 person die every year because of rabies. And you might have heard the story on television few months back when a father was carrying his child and no one admitted that child. He was having rabies. Even the AIMS and Safdarjung Hospital did not admit that child. Human papillomavirus vaccine. Currently, there are two types of vaccines, HPV 4 and 9-valent, to prevent cervical, genital, anal, head and neck cancers, and anal and genital warts. Previously, it was called cervical cancer preventing vaccine, but this prevents all types of cancers, head and neck, face cancer, even conjunctival cancer in ophthalmology. Because wherever there is touch of the sexual organs, whether on the conjunctiva, whether on the mucosa, as soon as the Serum Institute of India make the announcement that we are going to introduce Cervavac 4, the Cervarix vaccine, which was a 2-valent vaccine, disappeared from the market, even after the just announcement of the Cervavac 4 vaccine, because that was more costly than the Cervavac 4. Cervavac 4 cost about rupee 2000, whereas the Cervarix used to cost 2600. So currently, besides Cervavac 4, the Gardasil is also available. Cost is about 3800 rupees. And these prevent 83% of the cancers caused by human papillomavirus. Whereas Gardasil 9, which costs about rupees 10,500, they prevent 90% of the cancers caused by human papillomavirus. So currently, these are gender neutral vaccine. This should be given both to the boys and as well as girls. If the age is between 9 to 14 years, or even up to the age of 14 years and 11 months, 2 doses are recommended at 0 and 6 months. And between 15 to 26 years, 3 doses they are given at 0, 1 to 2 and 6 months. This can be used in females till the age of 45 years, but after one-to-one consultation, you may have to tell the lady that you may have been exposed to some of the papillomavirus if you are involved in sexual activity. So the vaccine may not be that much effective. Coming to vaccination in pregnancy, two types of vaccine are used, Tdap and Td. In government setup, Tdap is used 2 doses, whereas in private setup, Tdap plus Td both are used. At least 1 dose of Tdap should be given between 27 to 36 weeks of pregnancy. Second dose can be of Td. This can precede or this can follow Tdap. And beside this, flu vaccine should also be used in pregnancy. One thing I forgot to tell about the chickenpox vaccine. If the chickenpox happens to a lady 5 days before delivery and 2 days after, the infant mortality is very high in such persons. Because if the child gets infection from others, there is very high mortality. So coming to vaccine in the preconception period or young adults or especially young girls, MMR, measles, mumps and rubella, whether MR or even RVAC or rubella vaccine to prevent congenital rubella syndrome, and varicella vaccine to prevent congenital varicella syndrome. Besides the mortality concerned of if the chickenpox happens 5 days before delivery. Typhoid conjugate vaccine, hepatitis A and B vaccine, and human papillomavirus vaccine. Coming to adult summary, all the vaccine I mentioned in the last slide, plus pneumococcal vaccine, PCV 13, PPSV 23, then Tdap Boostrix every 10 years, zoster vaccine or Shingrix vaccine. Then in some special situations like yellow fever, if you are traveling to African countries or South American countries, you may have to go for yellow fever vaccine. And you cannot go from vaccine from everyone, say from me or from Dr.PAWAN Goyal. There are authorized center in Delhi. From that only you have to get this yellow fever vaccine if you are traveling to African country. Then meningococcal vaccine, this is optional vaccine for children because the meningococcal disease is not very common in India. So Menvio and Menactra vaccine, they are available. If you want to go to Europe or USA for study for 1 year or 2 years, then you will have to get this vaccination. And Japanese encephalitis vaccine only in the endemic areas. Indian Academy of Pediatrics recommend 2 doses at 12 months and 13 months. They are using killed vaccine. This comes by the name of G vaccine, JEEV. Whereas in the National Immunization Program, live vaccine is used at the age of 9 months and 18 to 24 months. That is made in China. Recently, the Mahakumbh was there. So I had written TCV, flu, cholera, and PCV. But this cholera vaccine was not available neither in Bhiwani nor in Gurgaon. So I had consulted Dr. Jeroda. He had recommended cholera also, but this vaccine is currently out of use and perhaps it is not being manufactured. Thank you, sir. This is the part 1. about this adult vaccination. A few more slides. If time is there, I can present them.
Yes, yes. Go ahead, sir.
I will have to call my daughter.
Sir, stop share this presentation.
Okay, stop share.
Yeah,
Okay,
stop share and then upload the other.
okay. Share.
Then upload the other presentation.
ठीक है. But this is also one of the talk I give in various ophthalmology conferences. Prevention of congenital rubella and varicella syndrome. The incidence of congenital rubella syndrome is about 1 lakh per year. There is a triad of deafness, cardiac defects, as well as cataract. In ophthalmology, besides cataract, there is microphthalmia, glaucoma, pigmentary retinopathy, and chorioretinitis. Deafness is of sensory neural deafness, and cardiac defects include ventricular septal defects, patent ductal stenosis, pulmonary artery stenosis. There are also microcephaly, meningoencephalitis. There can be hepatitis, splenomegaly, and developmental abnormalities like autism, visual problems, and hearing impairment. Rubella itself is a mild disease. I have never diagnosed a case of rubella. Perhaps I have never seen a case of rubella. This is a relatively mild disease, lasts only about 3 days. There is fever, some upper respiratory symptoms like running nose or mild cough. There is a mild maculopapular rash which starts from the face and it spreads to the trunk and extremities, and this disappears in 3 days. 25% of the patient they don't have any rash, and 20 to 50% they are asymptomatic. There can be lymphadenopathy, post-auricular, occipital, and cervical lymphadenopathy. Rarely there is arthralgia and encephalitis. The vaccination I have already talked, RVAC, MR or MMR vaccination. This is a picture of RVAC vaccine. Measles, rubella, and strategic framework. This is actually global measles, rubella, and strategic framework. In 2012 to 2020, this eliminated measles and rubella from 81 countries. And it is now planned that by 2030, the world should be free from measles and rubella, and also from these two type of congenital syndromes. By 2024, our five neighboring countries, they have achieved this, and India, we should also achieve this with the help of each one of you in next 5 years. Congenital varicella syndrome, the features are almost the same, but it occurs in 2% of the ladies. If they get infection, chickenpox in the first 20 weeks of pregnancy, then 2% of the children they may have some congenital defects. And if they get this chickenpox 5 days before and 2 days after delivery, 30% of the infants they die. All of you are familiar with the symptoms of varicella or chickenpox, and treatment is also available. You have to isolate. You have to give various anti viral drugs like acyclovir, valcyclovir, or famciclovir. So I have discussed already the vaccination. So this is all I wanted to. This is Shingrix vaccine. I have already told you. This is the picture of Shingrix vaccine. That's all I have to share. Anyone can ask any question. I will try to answer. And if need be, my guru is there, Dr. Ajayura. He can elaborate. Whenever some I get difficult questions from doctors or somebody else, and then I ask him that what is
There's a question by Dr. Arun Duggal. Which vaccines are recommended for young students going to foreign universities?
फॉरेन यूनिवर्सिटी में साबिक तो meningococcal है बताया अभी.
हाँ जी।
और बाकी जो करंट वैक्सीन अवेलेबल है सब सबको ही लगवा के यहाँ से जाने चाहिए। अभी अभी मेरे पास फोन आया किसी डॉक्टर का 2 दिन पहले ही, डर्मेटोलॉजिस्ट है हमारे शहर में। तो उनके पास कोई आया जी मेरे को ऑस्ट्रेलिया जाना है और काली खांसी का टीका लगवा, उन्होंने कहा जी काली खांसी का टीका लगवा के आओ। तो फिर उनको बताया कि मैंने टी डेप लगवाना है। तो टी डेप एवरी 10 ईयर्स लगवाना है, तो अडल्ट में वो भी रिकमेंडेड है सब सारे वैक्सीन। इनफैक्ट हेपेटाइटिस ए बी जो भी हमने बताए हैं, फॉरेन जा रहा है तो उसको वहां पे लगवाने पड़ेंगे, तो यहाँ पे तो रुपीज में खर्च करेगा, वहां डॉलर्स में खर्च करेगा।
नहीं सर, एक्चुअली every university, every country and every state, they have different recommendation and different this thing requirement for as far as vaccination of their foreign students are concerned. In many places, meningococcal is must. Other places, it is just optional. But Tdap, chickenpox, MMR, hepatitis B, these are the few vaccines which are usually recommended, and they are sought by all the universities. But we have to go through the university side. They usually get all the students, they get the email regarding their vaccination, and we have to follow that. But definitely you are right that this is a good strategy that we should give all the vaccination before to all our kids, those who are going abroad, so that they remain protected.
सर साउथ अमेरिका अफ्रीका जा रहे हैं तो सर येलो फीवर लगवाना पड़ेगा। यूरोप
हाँ,
अमेरिका जा रहे हैं तो सर
जहाँ जो
मेनिंगोकोकल। डॉक्टर अजय भी
There's
सर कुछ कहना
another
चाहेंगे?
there's another question by Dr.
यस मैम।
Pramod Gupta. How long protection lasts after pre-exposures prophylaxis of rabies vaccination?
Whatever may the time period, whether it's 10 years or 20 years, you will go for only 2 doses subsequently. If you have got this pre-exposure of three vaccines, then whatever may be the period, you have to go only for two more doses.
there are two benefits of the pre-exposure prophylaxis. One is that if there is any bite, you need just 2 doses. Another is, even if it is a category 3 or severe bite, you need not to take immunoglobulins.
Yes, sir. Very right, sir.
Sir, in Indian consensus guidelines, which are formulated by various associations like API, like RSSDI, like FOGSI, Indian Cancer Society, Indian Nephrology Society, and all of them have formulated an Indian consensus guideline. And according to that consensus guidelines, they have recommendations for healthcare workers, chronic diseases like diabetes, hypertension, heart failure, asplenic patients, and cancer patients, solid organ transplants or stem cell transplant patients. So, and according to the conditions of the patients, they have recommended certain injections as desirable, certain vaccines as vital, and certain vaccines as essentials. So, can you put some light on these essential, desirable, and vital vaccines for healthcare workers?
Sir, as far as the cancer patient or the other immune compromised patients, or whenever the window period is there, if you are going to start immunotherapy, if you are going to take out his splenectomy, elective splenectomy, then the meningococcal and pneumococcal vaccination should be completed at least 2 weeks before starting of this treatment. Suppose if you are suspecting a patient to be having some cancers, and it may take 1 or 2 months before the chemotherapy extra is started. So during that period, these meningococcal and pneumococcal vaccination should be given.
There
There's
are
another
certain guidelines as far as this thing is concerned. And for all these chemotherapy and other cancer treatments, there are the different recommendation as far as vaccination is concerned. In many places, we have to repeat the all vaccination schedule, especially like after bone marrow transplantation. But then for the chemotherapy and other things, we cannot give any of the live vaccine
Yes,
during
sir.
that time, even after some time also.
So you have to wait for 6 months to 9 months, sir. 6 months to 1 year after the completion of this chemotherapy, because the vaccines they are not effective for 6 months to 1 year. And Dr. Ajay, please
Yeah, I think
add something.
no, you're rightly said. In stem cell transplant, particularly, you have to repeat all vaccines, but solid organ transplant, you don't have to repeat all vaccines, but you have to repeat some vaccines. Depending upon your immunosuppressive stage is over, and when the patient is in a good condition, in that time we should give. Even for chronic liver disease, if you are willing for liver transplant, it is better to give vaccines prior to transplant, because we know after transplant efficacy is not so good. And you rightly said that hepatitis C, which is very much underused vaccine as far as India is concerned, but if you give hepatitis A vaccine, you will prevent fulminant hepatic failure. And if you see the total number of fulminant hepatic failure cases, hepatitis is one of the major cause. And few countries, by giving even single shot of hepatitis A vaccine, they dropped the cases of fulminant failure so much, and their incidence of liver transplant also reduced. So you can prevent the preventable cause of liver transplant, that is fulminant hepatitis failure. And second, on chronic liver disease, suffering from hepatitis B, hepatitis C, if there is add-on hepatitis A, the course is very severe. So at least on those cases also, you should give hepatitis A as far as A is concerned. And rabies, you very well said that it should be number one priority. At least health worker and those should take pre-exposure, so that you don't need the Dr. Mahavir already pointed out that you don't need at least immunoglobulin. And I want to say here one thing: in spite of so many webinars, still I see so many patients coming from corporate also, where RMO gave that vaccine. They use the gluteal region. So this is very important. It's such a fatal disease, and gluteal vaccine is not effective as far as rabies is concerned. If somebody has given vaccine in gluteal region, please don't count that vaccine. Give 5 more doses. Is my humble request that if you always ask a leading question, if somebody came from say any village and already received 2 vaccines, please ask whether the vaccine is given in gluteal region or your deltoid region. If given in gluteal region, don't count that vaccine. Again, give 5 vaccines, because this is such a fatal disease that if you give gluteal, it is not counted.
Sir, another route is where you can give it intradermal, but you have to give it on both sides, 0.1 ml on both sides. That will make it 1 dose.
And
If
Dr.
the vaccine
Taneja,
supply is less.
yes, Dr. Taneja, for private practice, we always say give IM, and
Yes, sir.
intradermal we only for government setup, because if you do not give intradermal properly, it's such a fatal disease. We
Yes,
should
sir.
not take a risk. So, as far as private practice is concerned, we always say go for IM. For government setup, because of the cost factor and because of the limited supply, we always say intradermal.
Yeah, but there are
There's
certain different regime also as far as ID is concerned. Many state government are following intradermal route also, but still many places intramuscular vaccine, rabies vaccine is being used. And for the all vaccine, for all vaccines, it is a dictum that should not be given. Of course, for rabies it is special, but otherwise also all vaccination must not be given in the gluteal. That is dictum that we must all follow.
There's another question by Dr. Ankit Saini in the chat session. Is it going to be the same for a patient who had dog bite and had all the doses of anti-rabies vaccine, but again after 30 days had a bite of grade 2 to 3?
2 doses.
No. After 30 days, no need of any repeat vaccination.
Okay,
Up to 3 months, if you are given 5 doses, no need of any vaccination. Just hygiene, water and soap wash, and proper care of the wound. No need of any vaccination if you have already given 5 doses. Up to 3 months. After 3 months, 2 doses. Dr. Taneja rightly said that after 3 months, 2 doses. But in this question, 30 days. So
30 days.
no
Okay, sir.
vaccination. No vaccination
But
required.
for the veterinary surgeons, the recommendations they are different. They have to get their antibody level checked every 6 months, and they may have to take every 6 months or like that. For veterinary doctor who handle such animals with rabies or do postmortem or some thing, their recommendations are different for
You
those
are right,
persons.
sir. For that is occupational hazard. And second, now we say ZBT. What is ZBT? 0/30 means we have to cut down the dog bite rabies by 0 up to 2030. So for that, we need at least a immunization of dog, because if you immunize rabid patients, you cannot cut down the rabies incidence of dog bite rabies. So to cut down the incidence, you have to immunize all street dog, private dog, and I think in next 4 5 years that should be a drive for that.
सर कुत्तों को कितने लगते हैं सर, वो मुझे नहीं पता, एक लगता
वो
है या ज्यादा
आप
लगते
करना
हैं?
पड़ेगा सर, उसके बगैर आप
नहीं सर, कितने लगते हैं सर उनको, कितने इंजेक्शन कुत्तों को?
sir, 2 injections in a year, and again after 2 years you have to repeat again, depending upon the different schedules and different type of injections. But problem is that nobody is aware of that, and no street dog vaccinated properly.
Sir,
I have a
anti-rabies
question.
vaccination का और है question. How to
Sir, I have a
proceed in case
question.
of missed doses of rabies vaccination after
Ma'am, I have a
exposure
question.
or pre-exposure doses?
Pre-exposure 3 doses, post-exposure 5 doses, if not vaccinated earlier. जिंदगी में आपको कभी भी अगर टीके लगवा रखे हैं, ये वाले आज के करंट वाले, भेड़ वाले नहीं, तो 2 ही लगवाने हैं फिर आपको कुत्ते काटने के बाद में, जिंदगी में अगर कभी भी ये लगवा रखे हैं।
कुत्ते काटने के बहुत क्वेश्चंस है सर, बहुत
पूछते
ज्यादा
Sir,
question है।
एक क्वेश्चन है सर.
हाँ जी
Sir, there is a vaccine of by the name TH rabies in the market by Cadila. They says that there is a if we are giving a TH rabies vaccine to any patient who had a dog bite, we only need to give 3 doses. It is a human recombinant type of a vaccine, sir.
037.
Ji, sir.
No, sir, no vaccine is 037. Even the human recombinant, that is the same dose schedule, and it should not be mistaken. That is probably they were just promoting it as the pre-exposure prophylaxis.
No. I think, Dr. Mahavir, this TH rabies is a new vaccine which they say that is 3 is equivalent to 5. But what I feel, as far as no so much, they have done some studies, but still we have to follow 5 rule. But their vaccine is for 3 doses, but not in pediatric use. They have done the study in adolescents and adults. So still not in IAP, but yes, in adult people are using 3 doses. But as far as no more literature is there, so we should take it with a pinch of salt that it is such a fatal disease. But you are right. In TH rabies, you have to give only 3 shots.
Yes.
सर,
yes.
थाईलैंड
For adults,
थाईलैंड
it is
में
3
थाईलैंड में सर
dose, 037.
चार लगाते हैं, उनके गवर्नमेंट का शेड्यूल है ना थाईलैंड का, उनका 4 ही है।
Sir, WHO now comes with four dose schedule. But as far as DCGI is concerned, in India we have to follow DCGI recommendation, that is 5.
037,
Short
14,
duration,
30.
we may come out with 4.
There, most of the country, they are following just 4 dose schedule.
Yeah,
And very soon in India also, it will be 4 dose.
it will
And
be
I
4
think
doses.
few pilot projects are already going on. One, I think, in Delhi also. And very soon we will be having just 4 doses only. And as far as this 3 dose is concerned, I think 037 doesn't make any sense. Even if they are recommending 3 doses, then the third dose has to be a booster, which should be given at least after 14 days. I don't know. I have not seen their studies, but let us examine that.
Sir, there are so many studies with rabies also, and it has been recommended by DCGI also. So, as per DCGI recommendations, they have given a schedule of 037, and they have 3 or 4 studies on their papers.
Yes, sir, for TH rabies. Yes, you're right, sir.
Yeah.
That
And,
particular brand, yes.
And sir, I'd like to ask a question to every member here. How many of you are vaccinated against influenza, typhoid, Tdap, hepatitis B, MMR, COVID-19, chickenpox, and pneumococcal? All these vaccines. How many of you?
Me all.
मेरा भी सर सारे लगवा रखे हैं।
Yes, sir, all.
Even Singarix and other PCV, everything.
Excepting typhoid, all these vaccines are either essential or they are vital as far as Indian consensus guidelines are concerned for health workers. So if we are not vaccinated, it is a humble request that we should get ourselves vaccinated against influenza, Tdap, hepatitis B, MMR, COVID-19, chickenpox, and pneumococcal.
One more thing, I think Dr. Ajay is also there. One more thing, it is regarding the cocooning.
कुपोनिंग इफेक्ट, यस सर। अगर आपके घर में सर बच्चा आ रहा है,
They
आप
are
दादा बन रहे
expected.
हैं, नाना बन रहे हैं, नानी
So
बन रहे
they
हैं,
should
दादी बन रहे हैं, या आपकी कोई मेड है जो बच्चे को देखेगी पहले 2 महीने, उसकी
all
वैक्सीनेशन
be
जरूर करवानी है।
vaccinated with influenza as well as Tdap. These are the two vaccines which are essential.
टीडैप के बारे में सर बताया मुझे, इन्फ्लुएंजा का डॉक्टर साहब बताएं।
नहीं, influenza also.
Yes, sir. Cocooning is very good effect, and Australia and America, they're following it. But one thing is very clear. As far as maternal immunization is concerned, we cannot compare that with the cocooning. So always give Tdap to mother 27-36 weeks, because the effectiveness of that 27-36 weeks is approximately 83%. Whereas if you give postpartum, then effectiveness is only 5-6%. So there is a huge difference. So this is a vaccine which should be given in third trimester to prevent infant pertussis, neonatal pertussis, because maximum mortality occur in first 2 months of life and after 65 years. Apnea, encephalopathy, convulsions, and mental retardation, all are preventable because of pertussis. So please always recommend maternal immunization as a top priority, and if you can give cocooning to elder people in the house, but for as far as mother is concerned, we should promote maternal immunization, sir.
Definitely, even the influenza given to the mother, it protects the newborn also. But since the influenza is having a very short life, so probably if everybody around in the household, if they get these two vaccines, probably that will be good. And these are not very expensive vaccines also.
इन्फ्लुएंजा के लिए बोलते हैं सर ट्रिपल इंजन की सरकार है, मदर को प्रिवेंट करती है, बिकॉज कॉम्प्लिकेशन ऑफ इन्फ्लुएंजा इज सो मच इन pregnancy is a immunocompromised stage. So if mother gets influenza, then complication of pneumonia and other complications are so much. Second, it prevents the fetus inside the womb. Third, it prevents the newborn up to 5 months, 6 months of age, because we give vaccination at 6 months. So initial months we prevent the infants also. So prevention of 3 with the one shot.
We have Dr. Ritu Jain with us. So I would like to ask her, which vaccines do you recommend for pregnant females? Dr. Ritu, please.
Yeah. Good evening, everyone. We immunize all the pregnant women with tetanus, then Tdap 26 to 37 weeks, and flu-vac, tetra-vac. But in private sector, all the patients are immunized and vaccinated and get immunization. But yet we have to see the same schedule in the government setup. Patients still receive TT, 2 dosage, and the ASHA workers, before the patient comes to us, sometimes they force them to get vaccinated with the second dose of TT rather than taking Tdap. So this is a sad state of affairs, because patients then compare the price of Tdap with the simple TT. That happens so many times.
Madam, in
Excuse me,
government
ma'am.
setup, TD is being used,
In
not
government
TT is not
setup,
being used now.
TT is being
TT is
used.
there, but not Tdap.
TDAP is not
TDAP
there.
is not being.
TDAP is not there, but
So
in place of
ASHA
TT is
workers,
there.
ASHA
Actually,
workers to
Tdap,
make
yes.
ASHA
Actually,
workers.
Tdap
Dr. Jain, you are not audible.
is important. It is important.
आवाज चली गई सर आपकी।
ASHA workers, they try to enroll the patient, so they give a vaccination and they say nothing else is needed. Sometimes it is difficult to convince them for the second dose. And so many times patient may take the vaccine from the chemist also. I don't know why, but we write on the paper that they have taken from elsewhere because we are not sure of cold chain if they take from outside.
And what about hepatitis B vaccine in pregnant females?
No, we don't give in pregnancy, but although matlab, we always tell them pre-pregnant hepatitis A, as you mentioned, typhoid, and other vaccines depending upon the previous history. If the patient comes to us in a pre-pregnancy state for the like counseling before pregnancy, we do tell them about all the vaccination.
Thank you.
If the mother is hepatitis B positive, then we give injection within 2 hours after birth of the child.
Yes,
Otherwise,
that
we
is
give
active and passive immunization.
plus passive immunization. Passive immunity
Yeah,
is
that is immediately after birth. That's a separate thing.
But Dr. Ritu, I think hepatitis B, there's no contraindication in pregnancy. If suppose that lady is not immunized, we can give hepatitis B in pregnancy also.
016.
Yes, sir. Definitely we can give. And but most of the patients are already immunized.
Yeah.
All our patients, we don't, of course, check the status, but we do ask you whether you were vaccinated. In fact, for HPV, we are very, very particular, especially in adult girls, whosoever comes for anything, even for UTI, we do tell them for HPV vaccination because it is so important. So try to cover most of the things
Sir, जब कोरोना
pre-pregnancy. Maybe because Dr. Mahavir Jain has inculcated so much in our mind vaccination. So maybe
सर
more
जब
sensitive due to that.
कोरोना चल रहा था जब तो प्राइम मिनिस्टर ने अनाउंस किया था कि 15 अगस्त को कोवैक्सीन आ जाएगा, लेकिन उसके बाद में क्या हुआ, क्योंकि प्लेटफॉर्म सबको पता था कि सेफेस्ट प्लेटफॉर्म है, फील्ड वैक्सीन बनाएंगे हम। और लेकिन उसके बाद में फिर अपोजिशन वालों ने इतना शोर मचाया, गिनी पेग बनाया, इस तरह के क्वेश्चन आए, तो फिर वो 4-5 महीने पोस्टपोन हो गया कोवैक्सीन का।
Dr. Rawal, please.
Sir, I just request all the healthcare workers who have received hepatitis B vaccine ever in the past, because many of us received early 2000, maybe when it was. All you guys should check. All you guys should check your anti-HBs levels. That's very, very important. Your anti-HBs levels are less than 100. I mean, 10 is the guideline, but we try to maintain around 100. So we just forget about it, because you guys are exposed too much, especially we gastroenterologists are exposed so much, and even the nurses, the staff. This is a huge recommendation to check for anti-HBs levels, and especially if they are less than 10, go for a repeat schedule. This is important.
That is very right, Dr. Pawan. But for the general population, we cannot.
No, sir, healthcare worker. Yes.
Yeah, healthcare worker definitely.
High risk populations.
High risk. Yes, definitely. And the usually booster doses given, they are always having an anesthetic reaction, and the antibody level increases so fast and so high. So I think one booster is good enough if somebody is having less than 10 antibody levels.
We'll debate about complete course and booster, but then booster will suffice.
No, Dr. Pawan, there is no debate as far as booster is concerned. Even if you have taken 3, even Dr. Mahavir rightly said single shot is sufficient. Second, you have to prove once that you should touch 10, because every time you cannot have 10. There is so much good anamnestic response, and incubation period of hepatitis B is too long. So if you give shot in between also, you will get the same level of protection. So you are right that we should check level and you should maintain 10. If suppose you checked your level and in 2025 it is 10. Suppose in October your level is not less than 10, then you don't have to repeat. So only one shot is sufficient, because once you prove that is about 10, means you are immune, your cell-mediated immunity is good, your memory cell is good. So incubation period is so good that you can prevent hepatitis B by giving by exposure only. So there is no need of repeating every time. But you are right. You have to check at least once.
More and more times, this is yesterday. There's a 40 guy who had exposure, and when he checked his anti-HBs, there were only 3. So actually exposing yourself, getting more immunoglobulins, which is very costly, and then all those stuff happens.
No, Dr. Pawan, I think we have two advantage with the hepatitis B vaccine or the disease itself, that this disease is having a very long incubation period, and over a period of last 40 years, it has been proved that the memory for the hepatitis B vaccine or antigen is very, very good. in almost 95% of the people, it's definitely memory is there. And once either there is a exposure to the disease, or if we give any extra shot of the vaccine, it will work same, and it has a very good protective level.
Because there's an anamnestic response. Mavi rightly said there's an anamnestic response, so you get. So, but you are also right that once you have to check that you reach the 10, because there is primary vaccine failure also. Some patient will not respond to hepatitis B. So you have to document at least one time that you have touched 10. If you are non-responder, you have to repeat. So you are right. We have to check once at least.
Sir, I had repeated only what you had said, that if the antibody level are 0, then go for 3 doses.
Yes.
No, sir. If the person is having documentation that he has received the 3 doses of hepatitis B previously, and now the antibody level is less than 10 or 0, as you have told, that just give one more shot and check the antibody level after 6 to 8 weeks. Probably you will find that he is having good antibodies.
If he is the responder, if he is non-responder, then have to give 3.
But then sometimes we have to give double doses also, extra doses also. But that is a different thing.
And as physicians, I think we should be much more careful about people who are having immunodeficiency. Sometimes we vaccine only real immunodeficient people, but people who have CLD, chronic liver disease, people who are IBD, who have potential to receive steroids in the future, maybe or immunosuppression, there's all those rheumatological diseases. I think we need still to boost up our concept of immunizing them early rather than waiting for.
Even in diabetic patients.
Yes.
Even you are very right. Any chronic disease is probably immune deficient or immunocompromised condition.
Even
That
those
is,
on
for sure.
salicylate also,
So,
they should also go. Chickenpox and
yeah,
because the salicylate,
yes.
long taking salicylate also, they should also at least immunize themselves for chickenpox as well as this type of vaccines. And I think very rightly said that zoster and varicella vaccine. These are two different vaccines, so one should not confuse with each other. One is for prevention of zoster, other is for the prevention of varicella. So if you are having complete documented history of varicella, still everybody are like for above 50, we have to take zoster because the reactivation of the disease, and even you are immunized, then again you are again chances of having zoster. So I think Shingrix vaccine we have to give good importance. And there is a very good study in 2024 that they found those who have taken these Shingrix vaccines in last 10 years, there's 20% chances of less chances of dementia. So there's a new study in Nature that in Wales, they in the even the live attenuated vaccine in 2,80,000 people, they studied that the incidence of dementia is 20% less, and even with the Shingrix, it is further better because it is a recombinant vaccine. Because they say in dementia, sometimes it is your virus which will be activated in brain also. So you cannot know dementias because of inflammatory response or because of reactivation of virus. So this very good study from Wales and from the US and Nature, very good. They have documented that there's a side effect or you can say better effect of Shingrix vaccine that you prevent the dementia as compared to those who are non-vaccinated.
सर एक और चीज स्ट्रेस करना चाहूंगा कि जब भी आप वैक्सीनेशन करते हैं या किसी को कोई भी इंजेक्शन लगाना है तो आपके पास वो लाइफ सेविंग मेजर्स होने चाहिए.
Yeah, this is very important.
वो एनाफिलैक्सिस को कंसीडरेशन में करते हुए पेशेंट को या जिसको भी आपने टीका लगाया उसको बिठाना है आपको आधा घंटा, क्योंकि ज्यादातर रिएक्शन आधे घंटे के अंदर हो जाती हैं. किसी
और एड्रेलिन आपके पास बिल्कुल रेडीली अवेलेबल होना चाहिए विद
सामने होना
एक्सपायरी
चाहिए
चेक.
सर, बिल्कुल सामने होना चाहिए.
सामने
प्रेफरेबली
होना
वो
चाहिए.
अगर पेन हो तो ज्यादा अच्छा है कि आपको
Yes.
भरने का भी वो ना हो.
Thank you, Dr. Narinder, sir, for the wonderful presentation, for the concise presentation. It was really thought-provoking for all of us. And I think if you can just write up also, write up also, so that we can put it on our this website also and in our journal also.
Sir,
That
I will
will be
send you. I have For most of them, I have a WhatsApp message I have with me, so I will send you, sir. And I keep on updating whatever message I have prepared for WhatsApp sharing.
So you are master of pediatric as well as adult.
सर ये आपकी मेहरबानी है, जो सीखा सर आपसे सीखा है। उसके बाद में
नहीं
सर क्या हुआ कि जैसे मतलब कि मेरे घर में धोती हुई, जब मेरी